I'm Dr. Scott Fuller. We're talking about spine exercises on our show today. I'd like to improve on and add to the spine stretches that I've been talking about for years in my office. All of my patients, unless of course you're an infant or a child, get spine exercises. And it couples so well with your chiropractic care. So once we get your spine in good shape in our office with the chiropractic care, I'm always after people to continue with their exercises. And it's like dental care. You go to the dentist and get a checkup and get a cleaning, but you have to brush and floss every day in between visits. Same thing with me. You might come into me for wellness chiropractic care every week or every month once your spine is in good shape, but you need to be doing these spine activities on your own every day. So we're going to review those. I'm going to give you some of the nuances, some of the common mistakes that I see people doing, and we're going to add a few more exercises to keep your posture and your spine and your brain and your nervous system, the rest of your entire body healthy as time goes along. So, starting off, we have the Fuller 5 exercises. You've seen this on this show. If you need to, you can review it on my YouTube page as well. The Fuller 5. So we're going to start with the Fuller 5, and then we're going to add to that. So here are some of the nuances. What I have people start with is the spine or cervical extension exercise, the extension exercise. Here are all of us in the computer age right now. We do this all day long, and hence most of us look like this when we get older. And that's bad. We know that it decreases your longevity in years, by the way. This has now been measured in years. It looks terrible. It feels terrible. It adds to arthritis and degeneration and chronic pain. So this is bad, right? So I teach people, hands on your hips, pull the shoulder blades back together like you're squeezing the shoulders together. That's important point number 1. Squeeze the blades together as far as you comfortably can, never into pain. And remember, don't let your shoulders rise up. That's bad, right? Does this look good? No. How about this? Yeah, that looks better. That looks better. So, blades together, hold, head back as far as you comfortably can, and then hold for a good long 10 seconds. So just count slowly to 10, and then relax. If you're in pain, acute pain, problems in your upper back, problems with your neck, disc problems, whatever, take your time, go slow, only go to comfort. So when people come into me with acute neck pain, they might start like this. Shoulders back, chin up. Or somebody that's older with a lot of degeneration and arthritis, maybe they can only do this. People in their 90s that come in like this, they literally can only do that. And that's okay. Got to start somewhere. If you have shoulder issues and you cannot put your hands on your hips, the alternative is just rest them on your legs. But you can do the same thing. Squeeze the blades, pull the chin back to comfort, and hold for 10 seconds. That's one of those. The second exercise is the twist. Always do it with a nice, tall, upright posture, the twist. Upright posture. Hands out in front if you'd like. Don't hold them up too high. Here is fine. Again, for you, if you have shoulder problems and you need to hold them down, I'll show you that in a moment. Here's the twist. Okay? I have people doing the beginning ones, 10 of these slowly in the morning and 10 of them at night. So with this one, if you have acute neck and back pain and you can't go the full amount, don't go the full amount. Listen to your body, keep it in the comfortable zone. That's an important point. Okay? Some people, this is their comfort zone in the beginning with acute neck and back pain, and that's fine. If you have a shoulder problem, you can still twist, see? You can still twist and get the exercise in your spine. That's good. Go slow. Okay, if you have dizziness, equilibrium problems, vertigo, balance issues, so when you move your head and neck around, you get dizzy and have those problems, keep your head still. Watch this. This is an alternative for all of us, by the way, and this is my preference. So here's me doing the twisting exercise. Okay? I'll do it like this. So really accentuating the torso and the lower back, but leaving the head still. You can do that. That's okay. You're working the joints, the muscles, the ligaments, the discs in your spine. And if you'd like to start with 10 of them in the morning and 10 at night, that's great. If you want to do more, do more. If you have a sit-down job, in a moment, I'm going to be talking about doing more of them throughout the day. Okay? So you've started off with one extension for 10 seconds. Then you've done 10 twists or more. Your next step now, that's 2 of the exercises. Your next step, let's do another extension. Shoulders back, make sure they don't go up. Squeeze the shoulder blades, feel those muscles work between the blades. Pull the head back, 10 seconds, comfortable. Now you've done 2 of these. Excellent. Now we're going to move on to exercise number 3, the side bend or the pendulum. Feet apart, again, tall, upright posture. We're going to swing like a pendulum. And here you go. Stretch the neck, stretch the waist. A rule with all of these stretches is I'm not pushing my body hard over to the side when I do these. I'm not doing that at all. I'm just casually stretching over to the side. That's the word I like to use with people. Casual. So do 10 of these slow and easy. Let's say you have acute neck and back pain. You might only go to here. Well, it's good to start somewhere. It's like a sprained ankle. If the physical therapist is showing you exercises for your sprained ankle, you're going to go slowly and within your comfort zone. You're going to let pain tell you when to stop. Same thing here. Later on down the road, you're able to go further. So you're going to do 10 of these minimum per side. I have people that do 20 or 30 or 40 of those, but if you're getting started, start with 10. That's exercise 3. Well, let's go back and finish these 3 with another extension. Shoulders back, squeeze the blades, again, not up, back, chin back, hold for 10 seconds. Those are 3 of the fuller 5. So you've done the extension, 3 of them. You've done the twists, 10 of those minimum. And you've done the side bend, 10 of those minimum. People always ask me, can I do them standing? The answer is, of course, yes. This is important too if you have a sit-down job and you're at a computer all day, right? If you're at a computer all day, take a break, stand up, and do a few stretches. You don't have to do a full set, just a few. So here's the standing alternative. I'm going to stand. So you can do the extension stretch standing, blades back, chin back, and hold. 10 seconds. That would be one break in every 20 minutes, let's say. Sit back down, go back to work. 20 minutes later, you get up and you separate your feet. Make sure you're not going to bang into anything. And you do a few twists. Okay? Just like that. And sit back down, work for a while. And then 20 minutes later, you get up and do a few side bends like this. So standing, you can do them always standing if you want to. I have a lot of people do them sitting just because I want them to be more solid, more comfortable, more stable when they're doing them. But if you are comfortable on your feet and you want to do these standing, it's a great standing break from the sitting position all day. So those are your standing alternatives. If you have a sit-down job, and on this show in the past, I did a show called Sitting Ergonomics, and I did another one called Standing Ergonomics. You can go watch those on my YouTube page. Okay, the other 2 for the fuller 5 are on the floor. These are difficult to do at work often. So you might have to save these for home. But if you have a place to lie down, I have people that go to empty conference rooms, or the gym if they have one in their office, wherever, to do these during the day too, okay? Flat on your back. Knees bent. This is called the knee roll. And you're going to roll your knees like this. A couple of rules. These are important. 1, go slow. 2, comfortable zone. If you go over all the way and that hurts, you went too far, back off. Common mistake. I have to go over this all the time in my office. So comfortable zone. And 3, casual. Don't aggressively push over to the side. That's destructive for this exercise as opposed to constructive. Casual. I'm just letting the weight of the legs stretch my back and discs and joints and so forth. Everybody loves this exercise. It's everyone's favorite. So the knee rolls, you can start with 10 of them each side, morning and night if you want. Or you can do like I do. I do 50 of them in the morning because I've found over the past 26 years of doing these, the more I do, the better I am. But don't start with that. Start with 10 if you're brand new to these exercises. The knee roll, that's exercise number 4. If you have time in the middle of the day and you throw in an extra set, bonus, particularly if you have back problems or if you want to prevent back problems. That's 4. The 5th one, knees to chest. Okay? So there's some options and alternatives here too. Take one knee, pull it up like this. A lot of people with back issues love this exercise. Let it down. Now this one, you don't have to do 10 of them per side. You can do just a couple per side if you want, but you can hold it as I am here for several seconds. And then down, pull it back up, hold for a few seconds, and down. One of the alternatives, if you have knee trouble, you can pull from the back of the knee, and then down. A couple of these each side is fine. You can do more if you like them, okay? And then down. And another alternative is both knees curling up into a ball and holding. You can hold this as long as you want, 2, 5, 10, 30 seconds, whatever. The alternative again is you can hold underneath the knees if you have some knee trouble and you don't like having them crunched like that. Those are the fuller 5. While I'm on the floor here, I'm going to add a 6th, actually, I'm going to add 2 exercises. So we're going to add 2 more. I've done these on prior shows, and I'm going to give you some alternatives here. Okay? So 2 more exercises I'm turning over. Okay. On this one here, this is from yoga. It's called a cat stretch. Let me give you some alternatives here and some guidance. Cat. On all fours. You can do this on your bed, by the way. And the knee roll that I just showed you, if you don't like getting on and off the floor, you can also do that on your bed. Totally fine, whatever you choose. I prefer the floor. Bed is fine. Number 6. Nice neutral posture. Arch your back like a cat. When I do this, I'm contracting my ab muscles a little bit, and I'm pushing a little bit with my hands, like so. Hold for as long as you like. 2, 5, 10 seconds, whatever. Back to neutral. Some people like to do what is called a cow in the other direction. I don't. A lot of people don't. The majority of people have too much curve in their lower back, so they don't like going that far. So I go back to what I call neutral, and then I'll go back and arch again. If you like doing the cow portion of this, you're welcome to do that. But again, the rule is just go slow and keep it in your comfortable zone. Follow? Now, if you want to, you can take it with exercise number 7, 6 being the cat stretch, 7 being child's pose. If your knees allow this, you sink back on your legs like this, extend your arms out, and you're in child's pose. Some yogis will do it like so. I let my elbows go soft, and you stretch back like this. A lot of people love this for their lower back, lumbar spine. It's a good decompression exercise. And if this looks similar, if you think about it, when I was on my back and I pulled my knees up to my chest, this is very similar. It's just in the other position. I just flipped over and I'm doing it. So you could hold this for, again, 2, 5, 10, 20, 30 seconds, whatever you like. Come back up. Go back into cat. Hold that for whatever you'd like to do. I'm relaxing my abs. Come back. And I hit on that one back into child's pose. You can throw in a couple of those if you want. So now that's 7 exercises, the fuller 5 plus 2, as I call it. But now I'm going to move on to exercise 8. And with all these exercises, you should not do these unless you have approval from your doctor, your chiropractor, your therapist, particularly with this exercise. This next exercise is a posture strengthening exercise. I call it prone because I'm going to be in the prone position lying on my tummy. Prone extension, because I'm going to be extending up. It's similar to the very first exercise I showed you. But this one's a little harder, a little more advanced. I would do this under guidance only. So, on your stomach, easy to do in bed. Arm position does not matter. I'm going to show you with your arms here because your arms are not involved. Arm position does not matter, okay? Step 1, lift your chin like you're looking straight ahead. I have pretty good flexibility. I'm just going to show you here. Lift your chin, so you're going to be working the muscles in the back of your neck, So you hold up. Part 2 is to lift your shoulders just an inch. Watch me now. Watch me here. Lift an inch. That's it. None of this hyperextension stuff unless you're a yogi and you practiced at it, okay? Chin. Watch your shoulders now. Shoulders just an inch. So you feel all of these muscles activate. But notice, this is important, notice how little I have to come up to make those muscles work. Chin up, shoulders just an inch, and hold. Now this one, just like the very first neck extension exercise, you're going to hold this for 5 seconds, 10 seconds, maximum, say 15 seconds, and then relax. Okay? And then you can try another one. Chin up, shoulders an inch, so you feel these muscles activate, and hold. Now, my arms are neutral. I'm not pushing, I'm not lifting. They're just relaxed on the ground or the bed, and hold. If you have any pain, neck pain, low back pain doing this, stop. Stop, check with your doctor, chiropractor, therapist, me, whoever, okay? But if it feels okay, that's the prone extension exercise. A lot of people that have sit-down jobs and yucky postures going in the wrong direction, they're doing this exercise to strengthen the posture muscles, keep that mid-back flat. Wonderful exercise to do there, okay? So that's exercise number 8. I have a ninth exercise. A ninth exercise. I call this one tall like a wall. It's similar to some of the exercises I just showed you, tall like a wall. And what it is you pull yourself up as if you're tall like a wall. Basically, you're pulling that way. You're trying to take the top of your head and put it on the ceiling. So let me start again. Let me start again so you can see this. I'm going to relax, okay? Not terrible, not great, okay? Pretty common posture, right? And now I'm going to go this way. I'm going to try to push the top of my head on the ceiling. You'll see that the main activity is happening in my mid-back spine, my thoracic spine here, my mid-back. That's where I can really feel the muscles working. And I pull up nice and tall like this, sticking the ribs, my upper ribs in particular, straight out to the front like this. And there's the exercise, tall like a wall. And I'm really trying to elongate myself. One common mistake is people do this on this exercise. Well, we're already covered that. I don't want you to do that. That's kind of cheating. Leave your chin neutral and go absolute straight up like this. You should feel the muscles here working. If you're feeling them work here, like between the shoulder blades area, you're doing it right. Okay? Hold this for 5, 10, 15, 20 seconds, and then relax. Now, of course, you don't want to sit like this all day long. 8 hours of this is always going to win. But here's the suggestion. If you have a sit-down job, do 2 of these exercises an hour. So let's say on the hour, you do one of these. One of the first exercises, the cervical extension exercise. Blades back, chin back and hold, say 10 seconds, and then relax. On the half hour, you do tall like a wall. Pull yourself up, super tall as you can without hurting yourself. Hold that for a good long 10 seconds, and then relax and go back to work. So every 30 minutes, you're doing a posture exercise. One of these per hour, one of these per hour. Does that make sense? So those exercises are really going to help you. And of course, you can do the standing portions of those too. And it's always great to get out of your chair and do these. So once again, you would get out of your chair and you would do on the hour an extension exercise. Make sure the shoulders stay down on this one. Pull them straight back, but keep them down. Hold that for 10 seconds. By the way, another caveat to this one too is don't hyperextend the lower back with this one. That's not part of the exercise. That's also cheating. It's only shoulders and neck, leaving this neutral, leaving that neutral. So you would stand up out of your chair, do one of these for 10 seconds, okay? And then sit down and go back to work. 30 minutes later, stand up and do tall as a wall, okay? If you'd like to, for an added benefit for most of us, add in a pelvic tilt. So you tilt yourself down, taking your rear end, tucking it down towards the floor, then pulling up nice and tall, extending the head straight towards the ceiling. Boy, that looks like pretty good posture as I'm looking over on the monitor. That's pretty good, right? So our goal, my goal with all of you, if you still have this capacity, is to maintain the ability to do this into your 90s, or as old as you're going to be. Now, when the 90-year-old comes into me, arthritic and degenerative, and already looks like this, and I say, hey, extend up as far as you can, and that's all they have, we're probably not going to get them to here again. That's not going to be our goal. But the more we do, the better. I've taken people in their 90s from here, and then after a few months of chiropractic care and exercise, I get them to here. Doesn't look like a big benefit, but if they feel much more comfortable, they're really happy about that, and it's totally worth the time and effort and money to come see us and work on these things. Okay? So now you have a variety of exercises. We went through the Fuller 5 and some of the nuances of those. The Fuller 5 plus 2, cat and child. Then we did tall like a wall. And then we did prone extension. So now we've got 9 exercises that we can work with. And those are all basic spine stretches to couple on with all of the chiropractic work that we do in my office. So, as wrapping up here in this segment, chiropractic care is incredibly important, particularly wellness chiropractic care, where you're coming in when you feel great. The best time to bring your car to the mechanic is when you just need an oil change and everything is fine. The best time to go to the dentist is when everything is functioning well, your teeth feel fine, and all you need is a cleaning, but you maintain that home care. The best time to come to a chiropractor is not in acute neck and back pain and migraine headaches and ear infections with a child and asthma. The best time to come in is when you're well, to perpetuate well, and then you do these exercises on a regular basis. Lastly, don't forget, on prior shows I've talked about ergonomics, sitting and standing ergonomics, getting out of the chair frequently and so forth. I have those videos on my YouTube page available to you. And lastly, don't forget about wellness chiropractic care. You always need to be doing that along with your spine stretches. I'm Dr. Scott Fuller. Please join me again.